Right. Good evening, everyone. And I would like to thank the uh, Association for the Study of Obesity and Francesco for very kindly inviting me to deliver on this talk. So, in this talk today, I will cover the epidemiology linking obesity to COVID 19, some of the postulated mechanisms, and I will finish with some patients' perspectives. So on the 23rd of March 2020, Public Health England issued guidance on social distancing. And in that guidance, Public Health England advised people who are at increased risk of severe COVID 19 to be particularly stringent in following social distancing measures. And one of these groups, which was identified as a high risk of severe COVID 19, was people with BMI above 40. However, at the time, while the data was building up, the evidence was building up nicely and strongly that age, diabetes, hypertension, and cardiovascular disease were all risk factors for severe COVID and adverse COVID outcomes, there was hardly any data about obesity at that stage. And there was still a query whether obesity prevalence is even higher in people with severe COVID 19 compared to general population. And unlike people with diabetes who had quite a lot of data available to them online and from their charities, trying to explain to them why they have an increased risk of COVID 19, people with BMI above 40 or obesity in general, they actually did not have that much access to information. And that resulted probably in increased anxiety in this population, which I will come to at the end of this talk, but also for many of us, and we wrote this in an editorial in the Lancet Diabetes, we had a concern that this could actually give false sense of security to people with BMI below 40 who still have obesity and might still be at increased risk. However, since then, the data has built up. And we now know from the study in France, which presented the prevalence of obesity in people who were admitted with severe COVID 19 and also in those who were admitted to intensive care in 2 cities. These prevalence data was adjusted for age and sex, and what it showed that the prevalence of obesity in severe COVID-19 was 35% higher compared to the general population. And similarly, the prevalence of obesity in those who were admitted to intensive care with COVID-19, and that's the adjusted prevalence, was 2 times to 3 times higher than the general population. And if we, instead of comparing with general population, if we compare with an ICU population, intensive care unit population, which is not the general population, you can see that the data from Leon and Lille, both are consistent, showing an adjusted higher prevalence of obesity in those who are in ICU with COVID-19 compared to those who are in ICU but without COVID-19. And this was the same in Lyon and Lille. Interestingly, this association between a higher prevalence of obesity in people with COVID-19, particularly in people with severe COVID-19, seems to have an age relationship. So in this study from Italy, which looked at people who died from COVID-19, it found that the prevalence of obesity in those who died from COVID-19 and were aged below 65 years was significantly higher than the prevalence of obesity in those who were above 65 years old and died from COVID-19. And that prevalence was 29% versus 9%, so quite a big difference. In addition, in this data from the Lancet, which looked at the relationship between age and BMI in intensive care unit admissions for COVID-19, you can see an inverse relationship between age and BMI, and this relationship was present in both men and women in a similar pattern and in a similar way, i.e., the higher the BMI, the younger the patient, or the lower the BMI, the older the patient. Now, this data suggests probably that the burden of obesity on COVID-19 is higher in younger population, this study and the previous slide, which I have shown. But I think it's important to take into account that this is based on body mass index, and older people lose muscle mass, and that can artificially lower the BMI. And as a result of that, older people can obviously have sarcopenic obesity. So I'm not sure BMI is the best way to try to show this data, but this is the data available at the moment. In addition, this study from Mexico, which included more than 50,000 people with COVID-19 and more than 5,000 deaths, looked at the relationship between obesity and intensive care admissions, mechanical ventilations, and hospitalization. And what you can see is that people with obesity were at increased risk of all of them, increased risk of intensive care admission, mechanical ventilation, and hospitalization. And that's despite adjustment for a wide range of potential confounders. You also have the data from NHS England, which looked at people with type 1 diabetes on your left-hand side and people with type 2 diabetes on your right-hand side. And you can clearly see that there is a dose response with increasing BMI in terms of the risk of death. So this is the hazard ratios for the risk of death in people with type 1 diabetes and type 2 diabetes. The reference point here is a BMI in the overweight range, not the BMI in the normal range. There is actually increased risk as well in people with a BMI of normal range. But people with obesity, there was a gradual increase in the risk of death in both type 1 and type 2 diabetes when it comes to worsening obesity. The relationship seems to be stronger in the type 1 rather than the type 2. And whether it is the obesity itself or the complications was tried to be answered by this analysis from a study, again from Mexico. And what you see here is the survival lines, 30 days, over 30 days period. The top line is people who have no obesity and no complications, who've got the best survival. The line below that are people who have no obesity but have complications. So you can see the reduced survival. But interestingly, the bottom two lines are those people who have obesity with or without complications. And you can see that those two lines are overlying each other completely, suggesting that obesity is probably a bigger driver of mortality than the complications in the study. And the authors concluded in the study that obesity mediates about 49.5% of the effect of diabetes on COVID-19 lethality. So after I've shown you the links between obesity and COVID-19 in terms of prevalence, as well as in terms of being a risk factor for severe COVID-19 and adverse outcomes related to COVID-19, what are the mechanisms? Obviously, this is not being explored fully yet. This is all postulated, but biologically plausible mechanisms. They were summarized in a recent editorial by Naveed Sattar, from which I took this figure. So on one hand, you've got increased ACE2 expression in adipose tissue. So people with obesity have increased viral exposure and increased viral load. At the same time, they have dysregulated immune response. This increased viral load with dysfunctional immune response could result in increased immune hyperreactivity, which contributes to the worse outcomes in people with COVID-19. At the same time, people with obesity have reduced lung volumes, mainly because of the adipose tissue around the chest, as well as the increased intra-abdominal pressure and reduced diaphragm contractility, as well as that they're obviously at increased risk of cardiovascular disease, blood hypertension, thrombosis, and diabetes as well, type 2 diabetes. All of these combined result in reduced cardiorespiratory fitness and increased susceptibility of the cardiovascular system to immune-driven vascular effects and thrombosis, all of which will result in impaired responses when the patient develops severe COVID-19. The combination of two might explain the increased risk of complications and mortality in people who have obesity, as well as their increased risk of developing COVID-19. In another paper which was published recently, another hypothesis came into light. This was published in the International Journal of Obesity. And what you see here is lung biopsy. So this is post-mortem. And you can see here what is labeled as L. These are lipid droplets. So these lipid droplets basically are fat embolisms in the arteries, in the capillaries in the lungs. And they probably came from the adipose tissue being infected with the virus, resulting in necrosis and inflammation, and then in the fat embolism. So that's another mechanism which probably also contribute to the links between COVID-19 and obesity. So as a result of the links between obesity and COVID-19, the Association for the Study of Obesity UK worked collaboratively with Obesity UK and the Obesity Empowerment Network, which are the the representative of people with obesity, and we did the consultation, and then we developed a call of action, which is currently in press in the Lancet Diabetes and Endocrinology, and should be published soon. But from the consultation, there were four main themes we heard from people with obesity. There was confusion and fear about the perceived level of risk. There was anxiety about access and provision of health care. They were worried about stigma, that the messages from COVID-19 could even worsen the already present obesity stigma. And there were concerns about the impact of lockdown on mental health. And the call of action contained several points, and here is a summary of them. There is a need to clarify the risk of adverse COVID-19 outcomes for people living with obesity, with specific recommendations for those at greatest risk, and also with specific recommendations to the healthcare professionals who take care of them. We need to provide clear guidance on how to manage the risk. We need careful consideration for the messages sent out in order to make sure we do not worsen the stigma. We need, on the long run, to acknowledge and hopefully utilize that the current pandemic offers an opportunity to consider ways to improve the healthcare system for people living with obesity and tackle stigma. And any action must be taken within the context of the experiences of people living with obesity and understanding obesity as a chronic complex disease. Accordingly, we call on the UK government to work with people living with obesity when developing the guidance, particularly for the post-COVID-19 recovery plans. So to summarize and conclude, obesity is associated with increased risk of COVID-19 adverse outcomes in people with and without diabetes. Multiple mechanisms such as impaired cardiovascular responses, inflammation, dysregulated immune responses, and fat embolism might link obesity to adverse COVID-19 outcomes. Improving access to obesity treatment gives an opportunity to improve the health of the nation and reduce the impact of COVID-19 and possibly future pandemics. And post-COVID-19 planning needs to involve people with obesity. And with that, I would say thank you very much.